Did you know your skin can reveal signs of diabetes? Yes, you heard it right. Your skin, the largest organ in your body, can act as a mirror reflecting what's going on inside. It's an intriguing concept, isn't it? Diabetes, a chronic disease that affects how your body turns food into energy, is a global health concern. The World Health Organization estimates that nearly 500 million people worldwide are living with diabetes. That's roughly 1 in every 11 individuals. More alarmingly, many people remain undiagnosed because the early symptoms of diabetes are easy to miss. This is where your skin comes into play. Our skin often sends us signals about our internal health, and this is especially true when it comes to diabetes. Unusual changes in the skin can be one of the first signs that something is not quite right with your body's blood sugar levels. From discoloration and dryness to unexpected rashes or blisters, your skin could be trying to tell you something important. Understanding these skin signs is crucial for early detection and treatment of diabetes. The sooner you catch the disease, the better you can manage it and prevent complications. It's about being proactive and taking charge of your health. After all, knowledge is power, and in this case, it might just help you steer clear of a life-altering condition. But what exactly should you be looking for? Well, there's a variety of skin conditions associated with diabetes, each with its own unique set of characteristics. Some are common and easily recognizable, while others might be a bit more obscure. But don't worry, we're here to help you navigate this complex landscape. Stay tuned as we delve into the 14 skin signs of diabetes you need to watch out for. This knowledge could be the key to early detection and treatment, potentially saving you or a loved one from the complications of undiagnosed diabetes. So let's get started. The first 3 signs to be aware of are darkening of the skin, blisters, and shin spots. Diving into the first sign, a darkening of the skin, also known as acanthosis nigricans, may be a sign that your body is having trouble processing sugar. This condition often presents as patches of darker, velvety skin in areas of the body that fold or bend, such as the armpits, neck, or groin. The cause? High insulin levels in the blood can trigger skin cells to reproduce at an accelerated rate, leading to this noticeable darkening. If you notice these changes, it's crucial to consult with a healthcare professional. They can guide you in managing your blood sugar levels and possibly reversing the skin darkening. Next, we have blisters, a rather uncommon sign but still worth noting. Known as diabetic blisters, they can surface when sugar levels are uncontrolled. These blisters are generally painless and can appear anywhere on the body, but they are most commonly found on the hands, feet, and forearms. They resemble burn blisters and can range from small individual blisters to more extensive clusters. If you come across any such blisters, keep them clean and protected to prevent infection, and reach out to your healthcare provider for further guidance. Finally, let's talk about shin spots, or diabetic dermopathy. These are patches that often occur on the front of both legs, although they can appear anywhere on the body. They are characterized by light brown, scaly patches that are often oval or circular. Why does this happen? Well, changes in small blood vessels can lead to these skin changes. While they're not painful or itchy, they are a visual cue that your blood sugar may not be well controlled. These are just the first 3 signs. Let's move on to the next set. Next up are skin tags, yellow skin, itchy skin, and red or brown patches. Let's begin with skin tags. These are small, soft pieces of skin that stick out on a tiny stem. They can appear anywhere on your body, but are most common on the neck, underarms, and eyelids. Skin tags are not harmful, but they can be a sign of insulin resistance, a key symptom of diabetes. If you're noticing an increase in skin tags, especially in unusual places, it might be time to have a chat with your healthcare provider. Moving on to yellow skin. This might seem a bit strange, but it's not as rare as you might think. The medical term for yellow skin is xanthomas. These are bumps made of fat cells that have a yellowish hue. They usually appear on the elbows, knees, hands, feet, or buttocks. Xanthomas can be a sign of high cholesterol, which is often linked to diabetes. As with skin tags, if you're seeing yellow patches on your skin, it's a good idea to seek medical advice. Next, we have itchy skin. While itchy skin can be caused by a plethora of reasons from dry weather to an allergic reaction, persistent itchiness, especially in the lower legs, could be a symptom of diabetes. It's caused by poor circulation and the effect of high blood sugar levels on the skin's nerves. Keeping your skin moisturized can help, but if the itchiness doesn't go away, it's time to see a doctor. Lastly, we have red or brown patches. This is a condition known as necrobiosis lipoidica, which is more common in people with diabetes. These patches start as small, raised bumps and gradually turn into larger patches with a shiny surface and visible blood vessels. They're usually found on the shins. If you notice any such patches, get them checked out immediately. Remember, these signs are not definitive proof of diabetes, but they are worth paying attention to. If you notice any of these symptoms, don't panic, but do get them checked out. Your skin might be telling you something important about your health. The 8th to 11th signs are eruptive xanthomatosis, diabetic dermopathy, necrobiosis lipoidica diabeticorum, and digital sclerosis. Let's dive right in and discuss these signs in more detail. First up is eruptive xanthomatosis. This condition is characterized by tiny, firm, yellowish bumps on the skin. They are often surrounded by a red halo and can be itchy. Eruptive xanthomatosis is usually a sign of uncontrolled diabetes, so if you notice these bumps, it's crucial to check your blood sugar levels and consult with your doctor. Next, we have diabetic dermopathy. This condition is often referred to as shin spots due to its common occurrence on the shins. Diabetic dermopathy presents as light brown scaly patches that are often round or oval. Though they don't open up or hurt, they are a clear sign of diabetes-related changes in small blood vessels. If you notice such spots, it's time to reach out to your healthcare provider. The 10th sign is necrobiosis lipoidica diabeticorum, often abbreviated as NLD. This condition is a bit rare, but when it does occur, it's significant. NLD causes spots similar to diabetic dermopathy, but they're larger and deeper. The spots might start as small, raised, solid bumps that become larger and then develop a shiny, porcelain-like appearance. They can be itchy and painful. If you see anything resembling NLD, a visit to the dermatologist is in order. Lastly, we have digital sclerosis. This condition affects the skin on your fingers, toes, and hands, making it thick, tight, and waxy. This can limit your movement and cause joint stiffness. Digital sclerosis is directly linked to high blood sugar levels. So if you notice these symptoms, it's essential to get your blood sugar under control and seek medical advice. These lesser-known signs are just as important as the more common ones. They all point to the same thing. Diabetes affects not just your internal organs, but also your largest organ, your skin. Recognizing these signs early can help you manage the disease better and prevent complications. We're nearing the end of our list, but don't go just yet. Last but not least, we have acanthosis nigricans, bullosis diabeticorum, and granuloma annulare. These are the final 3 skin signs that could indicate diabetes. And just like the previous ones, they should not be ignored. Acanthosis nigricans is a condition that causes dark velvety patches in body folds and creases. It's particularly common in people with diabetes, especially those with insulin resistance. If you notice these patches, particularly around your neck or armpits, it's a good idea to consult with a healthcare professional. Next, we have bullosis diabeticorum, a condition that's less common but still significant. It causes blisters to appear spontaneously on the skin. These blisters are typically painless and clear of infection, but they can be alarming. The exact cause of these blisters is unknown, but they're seen more frequently in people with diabetes, so they're worth paying attention to. The last skin sign we'll discuss today is granuloma annulare. This condition causes raised, ring or arc-shaped patches on your skin. While it can occur in people without diabetes, research has found a higher prevalence among those with diabetes. If you notice patches like this, it could be a sign of diabetes. Now, it's important to remember that these skin signs aren't definitive proof of diabetes. They're indicators, signs that you should consult with a healthcare professional. Diabetes is a complex condition, and these skin signs are just one piece of the puzzle. However, they can be crucial for early detection and management. So, what should you do if you notice any of these skin signs? The first step is to seek medical advice. Your healthcare provider can perform tests to determine whether you have diabetes and can guide you on the next steps to take. Remember, these 14 skin signs are critical for early detection of diabetes. If you notice any of them, seek medical advice immediately. Your skin could be trying to tell you something important about your health.